Good morning everyone. I am Dr. Sandeep Janardhan Dandil. I am a general and laparoscopic surgeon. Today's topic we are going to discuss is about the cushions in our body. You might be wondering what are the cushions in our body. So the nature or God has given us the different cushions which protects the joints, the muscles, the tendons over that area. So the function of them is to protect the underlying joint. These cushions are called as a bursa, and when they get damaged, medical condition associated with is called as a bursitis. So today we will discuss about what is bursitis, how many number of the bursa we have in our body, what are the clinical features, symptoms patient will present with, investigations and treatment related to it. So we will begin with what is a bursa. Bursa, it is a sac, or it is like a small cushion which is present in different parts, important parts, and they are filled with a liquid which is a jelly-like liquid which acts as a shock absorber for that area. So if you ask me number of bursa in our body, there are around 160 bursas in our body. They are located in different locations. So the common locations which are this shoulder area, the near elbow, the near the hip joint, the hip area, knee, ankle. There are two types, superficial and the deep. Superficial means which are closer to the skin, and the deep means underlying, which are little deeper. There are two types of the cushions. One is the constant and other is the adventitious. What do you mean by constant? Constant means the one which get by birth, from the birth, and adventitious is like one which we get later in our life. So what is the difference if you ask? The cushions which we get from birth will be having a liquid inside it, but the cushions which comes later in our life will not have a liquid in them. So this is the difference. Now we will discuss what are the causes related to this bursitis. Causes, if we discuss, is the infection, trauma, repeated trauma or repeated use of that particular part, the gout, autoimmune disease and certain systemic diseases. Now we will discuss what is bursitis, like how a normal bursa or a normal cushion becomes a bursitis, like when it becomes problematic. So bursitis, like whenever you get infection or you get trauma or repeated injury over this bursa, what happens is the body senses there is a repeated injury, and the cells which are lining inside, this bursa is made up of the cell which will secrete the fluid. So these cells will start growing and multiplying. Once they start growing and multiplying, they will secrete more fluid. These bursas are also supplied by the blood vessels. Now this, because of the infection and the swelling in that area, the blood vessels, the capillaries which are coming, they become permeable. Permeable means the gaps between them increases, and very high protein rich fluids start entering into the bursa. Once this fluid comes inside, there is more collagen deposition. Now collagen deposition means the fluid which is very soft and which acts as a cushion or protector, now it starts becoming thicker and thicker. It becomes so thick that later on it loses its capacity of giving a buffer action, and then it will present as a swelling. These cushions, this bursa you can imagine as a gel pads which some people use to protect the elbow joints or to the knee, or the insoles which we put in the shoes. What they do is they protect our tissues. Similarly, the nature has given us the natural cushions. So how the patient will present with when the patient gets a bursitis. Now whichever area these bursas are present, that area the symptoms will come. Now suppose you have the bursa in the shoulder region, and this is common. The bursitis in this area is common for the baseball players. Because of the raising the hand up and down continuously, there is a repeated injury over the bursa in this area. So what happens is patient will present with a shoulder pain. There might be swelling. But there is a limited range of movement in that area. That condition is sometimes called as a baseball player's bursitis also. The students, when the students sit on a bench, they will keep their hands like this. Because they are keeping continuously hands, what happens is repeatedly there is injury in that area. There is a bursa in this area. So when it's repeatedly injured, that bursa will increase in size. it might become reddish in color. The skin over that will become reddish in color. It will be painful. The range of movement will decrease. That's why it is also called as a student's elbow. Also, it is called as a carpet clearer's elbow or coal miner's elbow. Whenever there is repeated injury over the elbow, that condition arises. The next one I will discuss is a weaver's bottom bursitis. Now, weaver's bottom, because the people who sit for a long time for stitching and all, or the people who have a spinal cord injury where they sit in one particular position for a long time. So what happens is there is a bursa near one bone which is called ischium tuberosity. That area, this bursa will get repeated injury, and because of that will increase in size. It will become painful. Patient will have pain later on while sitting or moving. The next condition, iliopsoas bursitis. Iliopsoas is a muscle, and this happens in the runners. Because of the repeated injury in that area, patient will start having the pain which is deeper inside near the groin. The next condition is also called as housemaid's knee. Housemaid knee, because there are bursa or the cushions over your knee joint. There is a cap which is called as a patella in front of your knee. If you touch your knee, you will feel a small cap-like thing in front. That moves when you flex or extend your knee. So there are the bursa or this cushion in front of it, above it, below it. The housemaid, when she is bending to clean the floor, or the person who bends down to do certain things repeatedly, in those people, this bursa will get infected, or it will increase in size. So that's why it is called as a housemaid's knee. The clergyman, the priest who kneels down straight, mostly the bursa below the patella, that cap, it increases or enlarges in size. That is called as a clergyman's knee. Similarly, we have a bursa over the ankle joint, which is called as a calcaneal bursa. Now that happens in the people who are wearing a tight shoes. The repeated injury or your Achilles tendon on the backside of the ankle, there is a tendon which is called as Achilles tendon. The repeated injury in that area can cause the bursitis of that area. Now the symptoms what patient will present will be pain in that area, swelling will be there might be redness in that area, and range of movements will be decreased because of the pain. So over the ankle joint, when a patient is walking, patient will be having pain. So these are the different symptoms which patient will present in different areas, accordingly which bursa is affected. So if you ask me how the patient will present to the doctor, so depending upon which bursa is affected, that area you will be having pain or swelling. You will be going to doctor, and the doctor will be asking the questions related to it, since when it started, how fast it is started, and what is the duration. Like there are three types of the conditions where the bursa get affected. It is called as acute. Acute means first time when you get infection or swelling in that area. Then recurrent, like repeatedly you are getting swelling in that area. Like suppose you got this month, then another 2-3 months later, or every month you are getting a swelling which is coming and going. And chronic means the swelling has came and it is like that, it is not going down. So these are the three conditions where the three types of the bursitis which can happen. So the profession is important. So the doctor might ask you what job you are doing. So accordingly, if you are a baseball player, mostly the shoulder joint bursa will be affected. If you are a student, doctor might be elbow. The bursa over the elbow is mostly affected in the students or the people who keep the hands like this in this position or supporting over the elbow. Housemaid or the people who are kneeling, mostly they will have this bursitis over the knee joint. If the shoes are tight, doctor will diagnose mostly it is because of the bursitis over the ankle. So next thing which comes in mind is what are the investigations doctor might ask you. Bursitis is mostly the clinical diagnosis, but investigations which can follow are complete blood test. If it is infected, doctor will ask you to get a CBC done, complete blood test done. X-ray usually is not useful, but it will help us in finding what underlying joint, wherever the bursa is there, underlying joint, the bone, that area will be appreciated on the X-ray. Sonography will help us to find the size of it, amount of fluid inside. So it's an important investigation which doctor might advise you. Another investigation is MRI. If the bursa is deep seated and your pain is there, but outside you cannot see any swelling, doctor might ask you to do an MRI if he suspects it's a bursitis. MRI will give a clear picture of the size. If there is infection, underlying joint, the shape, the bone, muscle, it will give a clear picture about it. Now if you ask me what are the treatment options available for it, the first treatment option I will say is a rest. If you are repeatedly getting injured in that part, you should take a rest. Like suppose a baseball player having shoulder pain, doctor will ask him to take the rest. Now this rest is not like continuous rest. Your shoulder should be mobilized or it may get fixed in that position. So your doctor will advise accordingly. He will ask you to mobilize your shoulder after a few days. If it is on your elbow, doctor will ask you to stop keeping your hands in this position. If you are having a swelling on the knee joint, doctor will advise you to avoid that activity of bending or kneeling. Second treatment is a cold therapy, that is applying ice over that area. When you apply ice over that area, the swelling comes down. Sometimes it comes down, it helps in decreasing in size. Ice is usually applied for around 20 to 30 minutes at a time, 2 to 3 times in a day over the period of 10 to 12 days, and then we observe how the swelling is coming down. Third treatment which we can do is a compression. That is, if swelling is over here, doctor might ask you to put a tight bandage over there. That compression might help in decreasing the size of that swelling. Fourth treatment which we can do is elevation of that part. Suppose the swelling is here, it is swollen, doctor might ask you to elevate the hand above the heart level. So what will happen is that with the gravity, the swelling will start coming down. Similarly, if it is on the knee joint, doctor will ask you to raise the knee or the leg when you are lying down above the level of the heart, that is 45 degrees above, so that the swelling will come down naturally. Another treatment, next treatment which doctor will advise you is taking anti-inflammatory. These are the medicines which will help in decreasing the swelling of that area. So these drugs will be prescribed by the doctor, which might from 7 to 10 days according to the dose. According to your age, weight and all, doctor will give you the medicines. Doctor might ask you your allergic history, whether you are having a reaction with any drugs, and then he will prescribe these drugs to you. What other treatment options available are, if it is infected, doctor will give you the antibiotic treatment from 5 to 7 days or 7 to 10 days. Accordingly, doctor will take a decision. Then next treatment available is bursa, inside the bursa, steroid injections. Like some doctor might aspirate the fluid, they will put a needle inside the bursa, remove the fluid and inject the steroid injections. That doctor will take a decision only after. Initially he will give all the treatment of the cold therapy, raising the hand, compression, giving the rest. If it is not effective, then only will go for the treatment. One investigation which I missed to tell you is the aspiration of the fluid. Some doctors might ask you to put a needle and take out the fluid and send it for the testing, so that if it is infected, we'll come to know what bacteria or what infection is inside. We'll come back to the treatment part. After doing all this treatment, if it is not successful, like you're done, given rest, you're taken the medicines, compression, ice therapy, but it's not helping, then last treatment which doctor resort to is for surgical excision, that is removal of that swelling. So wherever the swelling is there, that is doctor will plan a surgery for that. Surgery, if it is a small swelling, doctor might do it under local anesthesia. If it is deeper and larger in size, doctor will go ahead with a general anesthesia. Mostly it will be a daycare procedure. Morning you will be coming, doctor will admit you, then procedure will be done under general anesthesia. Procedure might take around maybe 30 to 40 minutes. You can expect some stitches over that area, might either absorbable or non-absorbable. After surgery, doctor will put some pressure bandage over that area, and he will call you back after 5 days for checking the wound. And after 10 days, if he has put some removable stitches, he will call you back after 10 days to take out the stitches. So take home message what I will give you is, if you get a swelling which is over the joint areas like the shoulder or elbow or the knee joint, first thing, if you are doing a repeated activity, you should stop that. Take a proper rest, apply some ice over that area, compression, elevate the hand, then medicines after consulting doctor only. And if it is not helping, then doctor will proceed with your steroid injections, and if that is also not helpful, then only doctor will go ahead with surgery. So surgery is the last option in this. Most of the patients get treated and cured with medical treatment or conservative treatment. So hope you understood what is student's elbow, clergyman's knee, housemaid knee, weaver's bottom, and baseball player's bursitis. If you have any doubts about this topic, you can write in the comments. Thank you for watching me and my videos. Thank you very much.